Today's episode of HIPcast is brought to you by Harris Data Integrity Solutions. Embark on a journey towards unparalleled excellence and reliability in healthcare data management. Harris Data Integrity Solutions merges the expertise of Just Associates and QuadraMed Corporation, paving the way for a brighter future in patient data integrity. You'll have peace of mind that you are working with a SOC 2 Type 2 certified vendor. With SmartIX, achieve a unified enterprise master person index, ensuring seamless patient records across your entire health system with precision and accuracy. CuraMatch offers modern, automated HIM workflow solutions, empowering HIM teams with efficient patient duplicate detection and resolution processes. Streamline your MPI maintenance with Harris expert teams and tailored MPI cleanup solutions, saving you time and minimizing errors for sustained data integrity. Discover the power of Harris Data Integrity Solutions, shaping the landscape of healthcare data management. Explore their comprehensive offerings today at harrisdataintegritysolutions.com.
Well, we're in for a treat of practical and theory coming together with Professor Connie Renda today. Welcome to the show, Connie.
Thank you very much. Thanks for having me.
You're most welcome. I'm gonna read your pedigree for our listeners to get to know who you are a little bit. So in Connie's bio, Professor Connie Renda has been in the health information field since 1996. She was the founder of an HIS company in 2005 and sold that firm in 2013 to explore her passion to connect education and industry. Connie's currently the program director and professor of HIT at San Diego Mesa College. She helped develop the first baccalaureate degree in HIM at a community college in California by writing the application, creating the curriculum for 16 new courses, and preparing the program for ACCJC and KHIM accreditation. Kudos, that's huge. Professor Renda also directs and manages the Associates of Science program in HIT, which has an excellent and long-standing reputation as one of the first fully accredited programs in KHIM since 1968. She is also the VP of Industry Advocacy and Business Development for Verisma and has been since January of 2023, connecting the health information and revenue cycle industry with the company as a trusted partner and a thought leader. Connie writes quarterly blog posts on important topics such as HR challenges, interoperability, and operationalizing regulatory standards for health information partners. In addition, Connie has been a member of AHIMA since 2000. She has also been a member of RHIA and served as the director from 2017 to 2019 and is president-elect in 2023. Connie has presented at the state and national conventions on information governance, data analytics, HIPAA, and high-tech privacy laws, and other health information topics. She's certified with 2 AHIMA credentials, RHIA and CHDA. Her educational background includes a BA from Santa Clara University in psychology, an MA degree from SDSU in psychology and statistics, and an MA from the College of St. Scholastica in HIM and healthcare informatics. So, wow, what a pedigree. Again, thank you for being here.
Thank you.
So today we're going to talk a little about, your passion for education and how working in the industry kind of led you into the place of coming back into education to kind of bridge the gap. So one of the things that Seth and I've talked about before is the practical and the theory and what we're teaching health information students and then how they're, applying that out in the industry. And then also I may get around to asking you a few things about what some criteria or curriculum courses that we should be adding to curriculum to better prepare students for the way healthcare is done today. So moving maybe a little past the technical components of HIM to the more business or operational side of things. So again, welcome. We're so glad you're here.
Thank you. Thank you so much.
Are you in the San Diego area?
I am.
So I love San Diego. I think everybody loves San Diego.
Yeah.
I made the mistake one time of thinking San Diego was like, the Southeast U.S. and going into the Caribbean from a cruise. I'm on a cruise ship going out of San Diego. We're standing outside for the sail away party, freezing to death. I found towels and like wrapped me and my kids up because I'm like, I thought the Southern California place was supposed to be warm. Apparently, the Pacific is fairly cold.
It's always cold in San Diego. Isn't
Learned a
it?
lesson. They didn't teach geography in HIM school, so I had to learn geography and climatology. But that was not a prepared question about where you live. But I will go back to the prepared question and ask. This is something we love asking our guests, especially our HIM folks and HI professionals. How in the world did you end up in the health information profession? Tell us about your journey that led you to where you are today.
I love, same with Seth, I love hearing about people's journeys to HIM because nobody says in high school, or we didn't, 30 years ago, oh, I think I want to be a health information professional. It's nurse, doctor, firefighter, police officer. Those were the four choices, really. So it's interesting. I was getting my master's in psychology. I had really liked psychology as an undergraduate and people and the research part, not so much the psychology, like analyst person. So I was into psychology. I was getting my master's degree and a friend said, hey, there's this guy, he's sorting some kind of medical records. I don't really know what job it is, but it's $12 an hour. It's so much money. So you should definitely jump on this opportunity. So I quickly, ran over to apply for the job. And it was a release of information company in 96. And we were actually sorting through pieces of paper of records and then deciding, where they go and making sure it was the same patient for all 30 pages and put it in a nice little envelope, write on the envelope the full address, and then, mail those out. So I thought this is kind of, there's first of all, there's got to be a better way to do this. And, HIPAA was just starting. And so I thought there's definitely this privacy thing that we should probably pay attention to. Oh, yeah. Of course, in California, privacy was not really new when HIPAA came out, but in most places, but especially in California. So I fell right into it and just loved it. Finished my master's and started teaching in psychology a little bit. And then the company I was working for was the third employee, and they said, hey, if you want to do this full time, we'd love to have you. And I said, well, that's a great idea, but I have this master's and I want to teach. And he said, well, just keep teaching, but do this in the meantime. You're really good at it and be great. And so we had 15 clients in San Diego alone. By the time I left 9 years later, we had 1,000 clients in 11 states. And it was taking off because these hospitals said, we don't want to do this. First of all, the risk is tremendous. And who has the time and staff to do it? So it was just it was a perfect time to get into it. And I really loved it. I loved being part of health information. And then from there, I went on to start my own business, which also was fantastic, just to be able to groom people into that role, also have them understand and appreciate this very niche business that I felt came to love, and most of my employees did too. And then left that, sold that business and went on to teach full time. I said, I need to get back into teaching. I was teaching part-time still and statistics for healthcare. And I went into teaching full time. Well, that's when I started the bachelor's program in HIM, which was almost like starting a business at a community college. Lots of work, but very rewarding. And I had a phenomenal team at the college and our district. So it wasn't just me, but I was, of course, the subject matter expert in getting this pushed through. The impetus was this profession needed more rigorous education, and that you couldn't just have a high school education anymore and pull charts off a wall. It was becoming much more important to have that higher level of education, that critical thinking that the electronic record really brought to the table. And then after a few years of working in health information or teaching exclusively, I said, this is great that I'm teaching, but I don't know what I'm teaching after 5 years because I haven't been in the field. So went back into the field, and that's where I ended, and have been managing to do both, which I think is a perfect complement to each other, to both industry and academia.
Sounds like a fun journey. You said you're sorting charts, and it made me think of that long strip that we used to have in the medical records department that had the different fold over things that
like the fetal monitoring strips.
No, there was like a metal strip that would help you sort charts.
Okay. Sorry.
I know exactly what you're talking about. Those tools. Like I was laughing with somebody the other day talking about embosser cards back when we would stamp the records, and I'm like, oh my goodness, bringing back some memories here.
Yes. And one of your podcasts, you had interviewed Dr. Dixon Lee, and she was talking about the terminal digit filing. And you said, did she something? You said, do they still teach that in school? And she said, I don't know, maybe somewhere.
I wonder if they do.
I think we kind of
having all the rolls of stickers and all the fun stuff. And I always laugh and say, remember opening up a fresh packet of patient chart backs, and that smell was so good. It's like opening tennis balls.
Oh, the good old days, huh? The good old days when we had manila folders with beautiful multicolored, digits.
And beautiful thing.
Oh, it was a great thing. We had such control over who got access to records then.
There was a data set back then.
That's right. It was great. We knew what was on the right side and on the left side. And I bring up terminal digit filing in almost every presentation I can. I just did some presentations yesterday for some state HIM annual meetings that are coming up this month. And one of them is on data governance and AI and cybersecurity. And I was like, hey, remember when we had control? And there's a picture of medical record files with that terminal digit filing because it's a beautiful thing. But I appreciate, Professor Renda, that you were in the field for so long and you were an entrepreneur. I love how you keep reinventing yourself and keeping yourself relevant. It's awesome. So thank you for sharing your journey with us. But I love that you were, working for someone else. Then you started your own firm, and then you decided, I want to get back into the educational side of this. And then you go into education and then realize, wait, now I've got to keep a tie to the industry for relevance, right? Man, if we could all do that, right? If we could all have a connection like that. So kudos to you. And, I think when we think about the connection from academia and the industry itself, one of the things that I read in your bio is that you help your clients and health information partners implement or operationalize policy. This is the same thing, right? Academia and industry tie, bringing those two things together. So what we're teaching in theory, and then how to operationalize that in the real world when you get into the roles. So talk to us a little bit about what that looks like and about mentoring, and how important is it for the industry to grab a hold of students or young new professionals to kind of help them, foster them from that theory to practical.
So that's probably the best part of my job at the college, is making sure that students understand what's expected of industry in our industry, but also having those industry partners say, this is the future of health information. And the more you engage with them now and teach them what you know, the better our profession will be long term. So it's an investment for them, for sure. We have internships that require several hours. The lower division, they spend 135 hours on site somewhere doing some function in HIM. The upper division actually engage in a project with the facilities. And that's where I think it's probably the most important and relevant. So for example, many of these health information directors have these projects that need to be done, but who has extra time for extra projects? So they might have to roll out, like the 21st Century Cures Act when the information blocking laws came out. And how do you explain that to your constituents at the hospital? Not just the administrative people in HIM that pretty much understand that, but also the clinical staff. And so the students prepared a training for all of those different stakeholders to say, this is important, this is why it's relevant, and here's how you operationalize it in your job. It's not really different than what you've been doing, but now it's a law that you have to do this. And so they loved it. In fact, that exact student graduate got hired by that facility, having shown what she could do and shown what her skill set was. So that's really helpful. It's great for the facility to do a 2-month interview of the students and not have the risk. They've already cleared background checks. One of the things I say, especially in California, where we have lots of legal things that other states don't, I say they've already cleared all their background checks. They're not doing anything fishy. So when you hire them, you're one step ahead of just putting out an ad on Indeed. So.
Yeah, I guess a couple of follow-up questions. One is, how do you encourage students to then, once they get out into the industry, to remain engaged with the professional organizations? Maybe answer that one first, and then I have a follow-up about placement.
That's tough, actually. I think, especially being president-elect for California Health Information Association, all of our state associations and even our national association struggle with the younger generation understanding the importance of those organizations. Some of them do for sure. And some of them get engaged very early on. My students get engaged with the local newsletter and helping with membership recruitment. Some of my students are currently working on membership engagement and really like a data analysis of the membership data for CHIA. So some of them do get involved, but it is really hard to explain the importance, because really for us growing up, that was how we networked. We had to go to our local association meetings, right? We had to discuss and find our network physically. And so I think this day and age, I hate to sound old, the students know that they can engage on LinkedIn and send a message and, have a conversation that way and not really sort of bypass the traditional methods. But we are trying to change that and be more leaders in our profession and bring those emerging professionals up with us.
Well, if you figure out the magic formula for that, please share it with all of the states and also AHIMA. It is a challenge across. But this leads into my other question that I wrote down as you were talking about your students going out to these internships or clinicals. Is it more difficult now in a remote world and a centralized HIM office that we have to deal with largely? So I guess some industry or some CFOs would say that we get to deal with, but I don't agree with that necessarily. But is it harder to place students into meaningful hours for those rotations because of the remote status of things?
So for the lower division students, they have to get a hands-on setting. And there are still plenty of sites that have that hands-on. We're very fortunate in San Diego. We have a huge healthcare community. Our college has been in existence many years. San Diego Mesa College, since 1968, we've had a program. So our healthcare partners all know us. We're the only college in town. So they're very engaged with us through our advisory board. So they tell us and direct us with our curriculum. And so we don't have any challenges with placing students. They also go to a lot of non-traditional settings. We have a state prison here that our students work and they use Cerner, and they get to, get in there and do any kind of, chart analysis, any work that an HIM professional would do. So looking to non-traditional settings, I think, is helpful. Even some of the smaller, like an orthopedic clinic that doesn't value HIM like an acute care facility, but understands the need for some kind of record keeping and maintenance and governance. And so they've hired tons of our students thinking, wow, we didn't even know this existed. This is great. So thinking outside the box, I think, is the key.
The state prison thing's a very fascinating piece. Like I didn't really think about the prisons. I know here in East Tennessee, one of my fellow students when I was in HIM school went and did some of her internship at the UT Vet Hospital because it was one of the few in the country that's a large animal surgical suite. So they've got a massive record room, and she was learning the HIM practice. And there was an HIM professional that worked for that vet hospital.
Dr. Sue Gray.
Sue Gray, just wonderful person. Awesome. And it was fascinating. And then I remember my wife, we met when she worked in EMS, and she was like, I used to pick up veterinary students all the time from that surgical suite when they would see some things that they weren't prepared to see as students. But I guess the other question is with in San Diego, you've got a large military presence. Is there an opportunity for students in the military health service?
Absolutely. We have lots of students that work in our Veteran Administration Hospital. That's a great feeder program. They hire a lot of our students. They are primarily on site. So we have that. We have built a Navy hospital as well here in San Diego that we're not as engaged with as the VA, but it just depends. It varies. But we do have lots of non-traditional
It's a little tougher to get on
settings.
those bases, but I'd probably be like Top Gun, want to ride my motorcycle if I had a motorcycle like Tom Cruise out there.
Okay, Tom Cruise, just take it back a little, buddy. Take it back a little.
A lot of people think we look alike, and it's okay. I understand it. I've aged much better than him.
You're a foot and a half taller. Yes, also, I'm sorry, Tom. I'm sorry. I know you're going to listen to this health information podcast.
I hope he's listening. I think he is.
That's so funny. But Connie, if you don't have to answer this, this is not a scripted question, so you may not know these numbers right off the top of your head, and it also may just not be something that your organization is interested in sharing on a podcast. But I'm curious. You sound very fortunate to be in the area where you are and have the connections and ties to a lot of local brick and mortar places. We do a lot of online education these days, right? A lot online associate programs or hybrid programs. And so students are they're decentralized themselves, right? And so that makes it harder for placement of those things, at least in the brick and mortar way. You could probably figure out how to place them better in a remote setting if you're doing the online type. And then you would miss out on all of those traditional type functions and what the flow feels like. But I guess my question is thinking about where you are. What is your pipeline like? Are your student enrollment numbers, are they steady? Are they slightly declining? Are they on the rise? I mean, you sound like your program has figured out more because of geography, a good way to keep your pipeline going. How does that look?
So after COVID, honestly, our enrollment has gone down a little bit. And I think it was partly that, and partly unemployment is very low in San Diego. And so when you have unemployment low, you typically have lower enrollment in schools because people are finding jobs without getting the education. So it is a little bit lower. We still are great. We actually max out at 32 students per cohort because we're a cohort model, and we have about 19 to 25 on a regular basis. So we're fine. Would we like more? Sure. We actually have a partner. So our program is hybrid, so partially on campus and partially online. Our sister college, Shasta College up north, has a fully online program. So we did that purposefully so that the purpose of having a baccalaureate degree at a community college is to provide access to students who wouldn't normally be able to afford or access physically or otherwise a program. And our program is $10,000 for all 4 years for a bachelor's program, which is, of course, unheard of anywhere.
I wish I'd come there.
So good, really. Right? I'm actually talking at KHIM in September about doing this at other community colleges. I mean, there's about 25 states that allow community colleges to offer baccalaureate degrees in certain career technical fields, and those are great opportunities. So Shasta and us kind of share the responsibility of educating, baccalaureate level students in HIM. And it has been, again, to your point, Shannon, a little bit lower enrollment, but the key is, in terms of that brick and mortar piece, when you have on-campus class time, that the 21st century professional skills are what we're focusing on. So the content can be learned online. And I'm a firm believer in when you sit with somebody and you collaborate and you're working together and you're shoulder to shoulder looking at a monitor, figuring something out, there's an element of teamwork, collaboration, communication that happens that is very hard, not impossible, but very hard to foster in an online environment. And our employers, and through our advisory board, said, we need those skills almost more than we need the knowledge skills. Because the knowledge skills, I can teach them. I can show them how to do chart analysis. It's not that hard. But if they have a bad attitude or they aren't adaptable or flexible, that's going to be even harder. If they don't have global awareness when we're talking to our offshore partners, for example, they won't have an understanding of what that's like to have a different cultural background when you're talking to somebody. So those are the things that we try to really hone in on in an on-site environment. And that's why we like them going to places in person, because they learn how to get dressed and show up and park and be on time and send an email saying I'm going to be late or I'm sick today. Those are important skills that are hard to learn unless you're doing them. So
yeah, I think it's a really fascinating thing, because those are life skills that everyone needs. That sometimes you just need that extra push in an internship or a school program to say, all right, get out there and experience this, and experience how to work in a professional environment, and to show up dressed appropriately, and to say thank you and yes ma'am and open a door, and all the things that you have to learn how to live in civil society. But there are challenges with that. And I guess the last question here that I would have, especially because I think the concept has been fascinating, of how you've married practice and theory into one, is what are the challenges that we're facing as an HI profession? And this could be from an academic side or a practice side, but I think the challenges are there. What are you seeing there in Southern California that would apply out to the entire country?
Well, what I'm hearing from, I obviously have a good pulse on the industry, both from the academic side, and the CHIA side and the HIMA side. But even with our clients at RHIA, we have heard a lot of the same story. One is the staffing piece, that's just hard to find good people. It's hard to find the right people, reliable people. Some want remote. They don't offer remote. There's that challenge of staffing. And so, of course, as an outsourced company that provides outsourcing and tech-enabled kind of release of information and these other functions, where we want to help with that. And so we're always working with our partners on that. I think the payer relations piece is another area that's a big challenge, making sure that providers and payers are communicating, and that's just going to be difficult. And
Shannon's already laughing at that one.
Not to say anything about sides, payers.
So I'm like,
I always think it's so interesting. Like, if a hospital has to treat the patient, and the payer can say, "Oh, thanks for taking care of our member, but it cost you $100,000. We're only going to pay you $12,000, and I'm not sure where you're going to get the rest, but I'm sure you'll figure it out." And it's so funny to me that, you can't walk into Nordstrom and say, "Hey, I saw this $100 shirt. I'd like to pay $12 for it. I'm just going to take it." And nobody's going to do anything about it.
You could once.
You could do it once.
Right. It's right. And payers continue to do it. So that's, I think, a big challenge, and just managing the denials. And that's just a whole part-time job, really.
Yeah.
Full-time, I should say.
And
then the interoperability piece, I just wrote a blog on TEFCA, which will be out soon. Just, again, the government saying, "Hey, we'd really like you to have some interoperability." And all the hospitals and providers are saying, "Yeah, we'd like to also. We've been trying to for a long time."
Since 2011.
Like, "Well, we're just going to put this fire stuff in, and it's going to be fine. Don't worry. Don't worry. We're going to take care of it for you." But that's really a challenge, and not just on the on the provider side, just taking care of patients' interoperability, but also all of the functionality that comes with the challenges of exchanging information. It's getting bigger, and you would think it was getting easier because we're more technologically savvy. It seems like it's almost regressing a little bit, and hopefully we'll switch over at some point.
Yeah, I feel that regression deep in my bones, man, when I'm out, in the industry talking to health plans and talking to large hospital systems. And we can't it's illegal these days to have a podcast without saying AI. So I have to say AI. I guess maybe just a conceptual idea here to consider. What are you teaching? What's in program curriculum to address AI and the challenges and the regulations that are coming out? Or is it more just this is part of innovation? Or how detailed does curriculum get for health information students these days?
Well, the first thing that's the challenge in the academic side is having them not use ChatGPT to write all of their papers. That's the first challenge.
I have an idea for you that I'm using when I teach. I'll tell you that in a second, but carry on.
Okay. well, so embracing it in the academic level, embracing it and saying, let's all work on it. Let's figure it out. Let's put it in because it's a useful tool. And then let's work on how you can make it your own, and teaching them just like we do with research papers. You know, when you pull down a journal article, do you copy the whole journal article, or do you ingest it and convert it to your own thought? So on that side, on the AI side, I mean, obviously Verisma, I think many of our companies are working with any kind of AI tech-enabled tools. We have lots of, bot type functionality that allows us to do things more efficiently and better than humans. They get checked by humans, but this allows us to do a mass checking and making sure that our unauthorized disclosures, what we call them, can be, very, very close to zero. And so it's wonderful in that regard. And looking at it allows for, I think, unlimited possibilities in terms of the technology embracing what we're doing as a functionality, and using it properly will be very successful. It's a very successful tool.
It is. And I do think that, building governance structures from a health information content perspective by the health information community, I do think that helps to, that helps solidify our spot, and we don't lose yet another thing to somebody else. So, from a talking about AI and it's how you operationalize this AI policy and regulation landscape in the industry today, teaching students, and this is what I said in my, the presentations that I've prepared for that are related to that is, listen, everything that is generated from a documentation standpoint is still health information, and we still have to govern it exactly the same way. Even if it's being created differently, we just have to adjust the policy to take into consideration how it's generated. But everything on the other side that's generated has to be governed exactly the same. We just have to put policies into place to protect ourselves there. So I think that's very important. What an impact. Or you were going to say something, Connie?
Well, I was going to ask you what your tip was for the students. You were going to give me a tip. You had me on the edge of my seat.
So my tip is, I was teaching a master's level program. I think it was master's. It might have been a doctorate for a university in the middle of the country. And I had this student that kept turning in these amazing papers. And I was like, wow, these are amazing. And I thought, this must be the sharpest person. This is the sharpest tool in the shed. And every time we were scheduled to meet, she didn't show up. She had to cancel or just didn't call, didn't show up, whatever. And so then when she was going to do her final presentation, she said, oh, I'm just going to send you my PowerPoint because I have something to do and I can't make it. And I'm like, well, that doesn't work. You'll have to record your presentation and submit it. And it's going to cost you points because you're not doing the presentation in person or virtually. But I'll still grade it fairly. It was so very obvious when that person was doing their presentation, they had not written those papers. So my adjustment is, when you have a paper due, you turn that paper in, but it is also going to be accompanied by a 7 to 8 minute presentation where you throw together some slides and you talk through the points of that paper so that I know you understand the content.
Pretty good.
I like that.
Yeah, that's the only way I know, because I don't want them to not use the tools that are there. That'd be like asking them not to use a calculator.
Exactly.
Use the tools, but you still need to express to me that you can engage with this content intelligently so that I know that you're going to meet all the, the components of the rubric to grade you on that.
Well, that's a great idea.
Yeah.
I might have to borrow it.
Do it. Please do it, and put it into your programs that you're taking to baccalaureate programs to all these states. So this is what I'll say to you as we close. Thank you so much for teaching and leading and inspiring the next generation of health information professionals. But I am also going to tell you, Seth and I will be cheering you on to be able to get that baccalaureate program in those community colleges in those other 20 something states, because that is attractive. That
Very
is
much
what
so.
can attract students. And especially if we build a pipeline in middle school and high school and start driving those into those programs where they're more affordable, but they can come away with a baccalaureate and then get these RHIA jobs that pay better than a coder with a CCA. So thank you for that. We appreciate you being here today. And Seth, you want to close us out?
Sure, yeah. We want to thank our sponsor of this episode, Harris Data Integrity Solutions. Join us on a journey of excellence into the future of data integrity. Harris brings together the unparalleled expertise of Just Associates and Quadramed Corporation to revolutionize healthcare data management. You'll have peace of mind that you're working with the SOC 2 Type 2 certified vendor. With SmartIX EMPI, you establish a single source of truth across your entire health system, ensuring accurate patient records with up to 99% accuracy. CuraMatch HIM workflow solution offers an automated HIM workflow, eliminating cumbersome processes of remediating duplicates using spreadsheets while reducing errors. Say goodbye to time-consuming MPI cleanup maintenance. Harris Expert Team delivers tailored solutions for efficient MPI cleanup, customized to your facility's needs. Experience the power of Harris Data Integrity Solutions, shaping the future of healthcare data management today. Visit harrisdataintegritysolutions.com to learn more. Shannan, until next time, my friend.
Hey, I'll see you next time. Thank you.